Hi, I'm Liz Cattin. I'm the Network Director of Community Health for Peace Health, serving both Clark and Cowlitz counties. So our community health work is really focused on getting outside of the four walls of the hospital and really collaborating with our community, both partners, patients, and programs. So the work that we do gets outside of traditional healthcare. I think of traditional healthcare as very transactional. People come to us because they get sick. We do what we can to help fix them and send them back out into the world until they need our services again. What we're trying to do with community health is go beyond what happens within our four walls. We want to partner with organizations that support the health of community and that way also the health of our patients by providing services that healthcare doesn't do. We're really good at healthcare, but we're not good at housing. We're not good at food insecurity. We're not good at transportation or education. And those are the things that we know make a difference for our patients and for the health of our community. So what we try to do is partner with organizations who are good at those services, either through funding, through collaboration, or through new projects where we can work together to address the needs of patients in a way that will help to impact their overall health and hopefully not need our services as much. Currently, we have many partners who support the work of Peace Health, both inside our walls and outside of our walls. We have partnerships with different providers of primary care services that come on site to help transition patients who struggle to get outpatient care and sometimes use the emergency room for primary care, which we all know is not the best situation for individuals. So we work directly with partner organizations, provide them a landing spot on site and collaborative opportunities with our care management and social work teams to work together to provide for transitions of those patients. We also have similar services with substance use disorder programs where we provide space for providers of substance use disorder to come on site, work with, again, our care management, social work, and emergency room or inpatient doctors to help do assessments for patients who want to enter treatment and then go into treatment when they leave our facility. So those are a few examples of some of the work and how we interact inside our facility with partners that provide services that we're not experts in some ways. And then we also have partnerships with providers of housing and food insecurity resources where we have worked to develop programs with direct referral relationships, sometimes with opportunities for patients to take food home with them from the hospital when they let us know that they're food insecure. And those programs and partnerships are still developing, and we hope to expand on them as we start to look forward to the social integration of care with the emergency room. So right now, with the emergency room and the social integration of care, what we are working on is creating a space where all of our current and future partners can come together to provide services in a cohesive way, where an individual can come to us with maybe more than one need, clinical or non-clinical, and hopefully be able to access all of those services in one visit at the same time through partnership, collaboration, and a true collaborative space for partners. So what that looks like currently is we do have landing spaces. Some of our partners can come on site. They will be able to do their normal work that they would do in the organization that they work for, but do it while they're at the hospital. That makes them available. So if we have a patient who comes in that they could serve, they're able to respond. But it also allows them to be available for other partner organizations who might be on site and might be looking to collaborate with them to help serve the needs of clients that they're also seeing in our space. So one of the things we've heard a lot of questions about is how patients or clients will access the Community Connection Center. And what we're seeing is the Community Connection Center is really a vehicle to provide programs and partnerships and support to patients. So currently, the way we are thinking of the programs that will exist inside the Community Connection Center is that patients will not be able to just walk in. This is not a come one, come all center, although we will serve anybody who needs help. It's really an invite-in type of program. So some of our community partners who have community health advocates that go out into the community and work with individuals who are vulnerable or in need can talk to somebody and invite them into the center and say, hey, I can meet you at Peace Health tomorrow at 11 o'clock. You know, I know that you've been wanting to take a shower and do some laundry. So I have a reservation. You can come at 11, you can meet me there, you can take a shower, you can start your laundry, and while your laundry is going, let's do that assessment that we've been talking about doing for 3 weeks. And oh, by the way, while you're here, we have somebody from one of the outpatient clinics who can help get you some follow-up care. And we also have somebody from our substance use disorder treatment program that we partner with who maybe can help you, even though you're not ready to go into treatment. Maybe they can provide you some information. So we see this really as a way to create access, to create an invitation in, but then also circle the wagons, so to speak, around people who have needs. We also expect that more often than not, a lot of the individuals who need help and will access care through the Community Connection Center will come through the emergency room, or who will come through our inpatient hospital. So partners may not just invite people in, but they can go down to the emergency room and have conversations with individuals. They can go up to hospital rooms and have conversations and really provide those services and that warm handoff that we know individuals need in order to really take advantage of the care that we're offering.